My name is Afanko Fuller, an associate professor of health systems and policy at Strathmore University. At Strathmore, we do research, training in healthcare management, policy development, and policy support for public and private institutions. So our experience working with both the public and the private sector is, just the fact that particularly the government, the public sector, they don't necessarily take a lot of outputs that are coming out through the academic processes. So there's a schism between the government and what they're doing as policy and what the research community is doing. And the challenge with that is, first of all, it ensures, it kind of invalidates the benefit. It reduces the benefit of research in terms of transforming policy on one side. But it also, doesn't deliver the benefits to, Kenyans and Africans that should be there through the policy process. And a major reason why that problem exists is because a lot of research community members don't actually understand the policy process. They don't actually appreciate the complexities that go into making policy decisions. They don't know the right places of intersection, basically which is the best place for me to come in the policy making process. So what we're just trying to talk about is highlight the fact that policy can be made through parliament, and there you end up with laws. It can be made by the government itself, what you call the executive. So this then becomes the sector policies, like the health policy or a policy for a specific aspect of health. But it can also come through a judicial process where the courts rule that this is the interpretation of the law, and that then forms the basis for policy. So because of these different aspects, researchers need to be more aware that these are different. They require you to engage differently. But in addition to that, there are other less visible players or actors within this ecosystem who play a very important role in shaping policy. We are talking about communities. Sadly, communities are very powerful, because remember how government work is the leaders of government are actually elected by communities. So they listen to communities more than they listen to technical people, because their jobs are given by communities. So if researchers can find ways of engaging the community more strongly, then it means the communities can actually be the advocates of translating research into policy by demanding that the persons that they have elected actually follow what they have been told reliably is actually the right thing to do through evidence. Roughly a third of our budget is supported through development assistance. They have a lot of sway as well. So if somebody is giving you a third of your budget, it means they have ways of influencing things. So we also need to work very, very closely with development partners, figure out the best points, again, of interacting with them, and how then that can lead to policy influence as well. And of course, there are the actors. And one of the most important actors that we don't think about is Treasury and the people who actually determine where resources are going. Again, these are not people who read research outputs. They're just people who need you to explain. You've done this research and it's actually shown this is the impact. What does that mean for social and economic development of the country? What am I buying? Treasury officials want to buy results. They want you to demonstrate to them that by doing A, B, C, and D, you'll reduce these costs in this way, and you'll actually allow us as a country to achieve this social and economic development in this way. They'd be more than happy, again, to be advocates to ensure that the right resources are actually availed there. So these are some of the conversations that I think we need to have more moving forward. Let us work with policymakers. They can be a bit difficult to work with, but once you get them to understand it's on autopilot, they're going to fight for you. And then let's work with people who actually control resources. Again, you need to also recognize that they're dealing with a lot of demands from different ministries. Somebody has to decide, do I give more money to roads? Do I give more money to energy? Do I give more money to healthcare? The roads guy is showing how the economic development in an area will be opened up fully if they put a new road. You're just asking for more doctors and nurses. You need to change the story and tell them that those people who are producing flowers in that area would actually be able to have a 30% more productivity because they are going to the hospital less. Those are the stories that we now need to start using, because that is how policy responds. Thank you.